My name is Ernest Grant. I am president of the American Nurses Association and also a member of the Zetema Project. The American Nurses Association, we represent the interest of the nation's 4.3 million registered nurses. We are an advocacy group that helps to set policy guidelines and, of course, a legislative agenda for the nursing, for nursing, the nursing profession, and for the patients that we care for. Currently, there's estimated to be about 4.3 million registered nurses in the United States. One of the biggest challenges that they are facing, or what we're hearing from nurses, is one, regarding the COVID-19 crisis that we're facing. They feel that they are not really prepared to take care of the patients, mainly because of the need for the PPE or the personal protective equipment. Obviously, they're concerned about not being able to provide safety for themselves as well as for the patients that they care for. And there's the fear of taking this virus home to their family members as well. Until all nurses feel prepared, then we've got a lot more work to do. Another thing is I think we need to think about the mental health and stress of the healthcare provider that this particular situation is posing. Whereas you may be used to maybe one person dying on your unit, every 2 or 3 weeks or so, and now you may have 5 or 6 people dying within a 12-hour shift. That can be very straining, not only physically but also mentally as well. Regarding advanced practice nurses and their role, particularly during this crisis, the American Nurses Association has always advocated for advanced practice nurses to be able to have what we call full practice authority, or to be able to practice to the full extent of their educational level or training. And we continue to advocate for that. We're very happy that obviously a lot of the restrictions have been lifted right now during this crisis that would allow them to practice, like using telehealth, telemedicine, things of this sort, things that we've been advocating for all along. We're all in this together. We're all part of the healthcare team, and this just goes even further to prove the role that the advanced practice nurse has and can do to help alleviate the physician shortage and still provide the care that is needed for the patient population that is out there. I think just in general, the way we practice medicine, or the way we practice healthcare, is going to have a whole totally new focus. From a perspective, I guess, of the public right now, obviously there's probably going to be continued increased use of telehealth, telemedicine. I think the public themselves have a different view and value of those of us who are in healthcare. The healthcare worker, they understand the role, particularly the role of nursing, but the role that all the members of the healthcare team play. So there's going to be an increased value and respect, if you will, from the public about who we are and what we do also. I think we were already tending to see healthcare moving out of the acute care setting out into the public or the rural area. So this is where, as I mentioned, the use of telehealth, telemedicine, will come into play. I think you're going to see a lot of changes in how we triage patients as well. What's going on that we may nowadays or prior to COVID-19 see something as an acute situation. Perhaps that's going to be viewed now as, what's another way that we can treat that? Do we really need to admit this person to the hospital, whereas maybe they could be managed in a slightly different way?